Hi, I'm Shannon Knight, two-time breast cancer survivor. Thank you for joining me. I had stage 3 in 2010. I had stage 4 in 2010, stage 3 in 2006. And today I'm going to be talking about the pain management struggles that I went through both times, stage 3 and stage 4. I cannot believe what I've learned as far as becoming over-medicated. I have all of my medications with me from that time period. And I want to start off with the number one. I came across this cleaning out my closet, my containers, and just making everything neat. And it's funny how you hang on to stuff that you don't remember even doing. I didn't remember about the fentanyl, which is today I found out and posted below 40 to 50 times stronger than morphine. Look that one up. I was also on hydromorphone, which is stronger than morphine, and that was in 2006 when I had the bilateral mastectomy. I want to say hello to everybody that joined me. Hi, Kathy. Hi, Leonard. Hi, Deborah. Hi, Susan. Hi, Leslie. Hi, Virgil. Thank you for joining me. I hope you'll share this with anybody that's struggling with pain management, whether it's from cancer, a serious injury, or surgery. There are so many things that I didn't know about my medication. I just trusted my doctor and went on what they gave me. Even though I filled out my health history of what I was taking, I couldn't believe it. There was a contraindication at one point when I had stage 4, when I was on prednisone. I was on the fentanyl patch that I have right here. It shows it was given to me June 24th. And this is 50 micrograms. These are the packets right here. This stuff killed Tom Petty. It was given to him as well as he was doing in anti-anxiety, I believe, a benzodiazepine, which they gave me as well. When you get diagnosed with cancer, hi Manuel, it's very common for one of the first medications they offer you out of compassion is a benzo, like Xanax, clonazepam, lorazepam. So when you read about the contraindications or what you're not supposed to be taking that could cause a fatal, you could die. That is one of the drugs that you're not supposed to take with the fentanyl. When I had this on me, I fainted, number one. I fainted in the elevator on my way to an appointment, and they had to put IV fluids in me and everything. Hi, Bill. Hi, Anna, Lisa. You know, we talk about alternative cancer treatment, and it's mind-boggling that we don't talk enough about the pain drugs that they give us, because we know that that constipates us. We know that that stops us up. But it also affects your heart rate and your moods and your decision making. There are a lot of things that it does that are harmful and fatal. But I want to read something to you from the very first part of this medication, which was never said to me. They just write the script and give it to you. You fill it, and you're kind of out of it. You get diagnosed with stage 4 cancer, and you're going through a lot emotionally and mentally. Right here, it says on the fentanyl transdermal patch that it requires continuous around-the-clock administration. So you have to be careful. It's a 72-hour patch. Take it off regularly, but you're wasted. You actually need someone to take care of you, to help you with all of that. If this is 40 to 50 times stronger than heroin, what do you think your mind is like? Think about it. I couldn't even get up out of bed. This was 50 micrograms. It's used for post-operation. It's not meant to be on continually. Hi, Dawn. Good to see you. I printed out, actually, some of the side effects, and it's nausea, diarrhea, heart rate change, blood pressure dropping. When you're on something that strong and you're trying to battle stage 4 cancer, think about the decisions that you have to make about saving your life. You are getting chemotherapy. What are the side effects of that drug alone? We always hear about the side effects of chemotherapy. Let's throw in if you've got cancer in your lungs like I did. They had me on 3 different inhalers. Okay, I remember taking them as a system. And I was also doing the albuterol in a nebulizer. Then this, then the benzo, then the prednisone. I have a feeling, because I have talked to many individuals going through cancer who have shared with me the intimate details of what drugs they're on and how frustrated they are. I forgot the most important one that affected my memory, Neurontin. Anybody know about Neurontin or gabapentin? I just want to get a little feedback if you've heard of fentanyl, Oxycontin, morphine, hydromorphone, lidocaine, the patch. Hi, Diane. Good to see you, sweetie. Hi, Ashley. These drugs are given out so liberally. I had a drawer filled, and I didn't want to take them. I didn't want to take them because I was reading about alternative cancer treatment, and I did not want to have those side effects on top of everything else while I was trying to raise money and get to Mexico. The fact that there is a problem with family and friends in many of these conversations that I have that don't want them doing the CBD or the hemp oil is mind-boggling. I would like everyone to just really, truly take a look at the side effects of fentanyl, dangers, fatal dangers, compared to CBD oil or hemp oil, or smoking a joint, to be honest. I'm not afraid to say that. I've been around too many people who don't even remember having a conversation with me at all. They'll talk to me. I'll get on FaceTime with them. They'll call me again, and they don't remember anything that they said to me. Morphine makes you lose your memory. And I'm not picking on you. I'm telling you that I want you to look at your medication. I want you to see if they're overprescribing. One of the times when I had stage 4 and I was on the prednisone and I was on the fentanyl and everything else, something happened to me where it made me get in the car. I was watching the Lakers game. I was in shorts and a tank top, Lakers, and I started driving down the street and I hit a curb as if I was just a drunk, and I was terrified. So I went to Domino's, parked my car, and called the ambulance, told him to call the ambulance and get me to the hospital because I didn't understand what was going on. My blood pressure was 180 when normally my blood pressure was always like 85, 90 over 55. It runs in my family. We need to start taking a better look at the side effects of the drugs that we're taking. Not just the cancer treatment and the chemotherapy, but if you're going through chemotherapy and you're going through all of these drugs as well, I want you to start thinking about, after your cancer treatment, does it seem to make sense to detoxify your kidneys, detoxify your liver, and to get this junk out when you get through to the other side? Because alternative cancer treatment, whether you do it before, during, or after, makes the most health sense, more health sense than anything we're getting in America. When I go into a pain management, I don't anymore, but when I did, there would be people sitting on the floor in the office, and they would it was like legalized drug pushing, because maybe I was stage 4 and they didn't care if the drugs contraindicated one another. She's going to die anyway. She's been given 3 months to a year. What do we care? Let's just give her this crazy 40, 50 times stronger than heroin medication for her bone pain instead of trying something else. I don't understand it. And doctors know this. I know there's a few doctors, I've talked to them, who have no problem smoking a joint, but they can't have a private conversation about its ability to increase. By the way, I lost so much weight. These drugs have horrible side effects. So if you're going through a staph infection, like I did with my bilateral mastectomy, I was dealing with pain medicine, nerve pain. That's what the gabapentin is for. It blocks the nerve. if you're going through all of that, you're going to lose weight. You're on an antibiotic, and that's making you lose weight. My IV antibiotic was Augmentin. Look it up. It's 2 types of medication put together. How in the world can anybody expect to keep any weight on or eat anything? I had my friends at my house literally taking my drink, my water, and telling me to pretend it was an IV and just put a couple drops and hold it in my mouth so I'd get hydrated. That's how sick all of the drugs made me. Not the staph infection, the medications, all the side effects. I want you all to please share this with people who are, you know, they're taking a lot of medication and they've kind of surrendered to it all. Hi Laura, it zaps their brain and it doesn't give them clarity anymore so that they can be empowered over the disease. This fentanyl killed Tom Petty. This fentanyl is 40 to 50 times stronger than heroin. But we have groups on drug addicts that are out there doing street drugs with heroin, and we don't even see the bigger problem right up close in our home with our family on a drug that is over medicating them. The reason I have leftover medication is I chose no. I said, I'm not doing this. There's something wrong. Why am I fainting? Why am I vomiting? Why can't I get up off the floor? Literally, the mattress was put on the floor to keep me safe so I wouldn't fall off the bed. Why are stage 4 cancer patients being over medicated? We have to address this. We have to look at other ways to address pain and take it seriously. I'm never going to throw this away, and I'm certainly not going to sell it, but I'm going to keep this because I want to remind myself of what I pushed through, what I got through, going to my son's wedding and not taking this. I actually had to go through a withdrawal. Imagine going through withdrawals for heroin. We see movies, the dramatics about heroin. Imagine coming off of this and our patients doing it safely. I had a mother call me back in 2014 about her daughter in the hospital and that they couldn't manage her pain. She tells her story. She reminds me of, you know, you hear of these ghost stories where the ghost keeps coming back trying to say the same message over and over. She's been haunted by the death of her daughter. Her daughter, she swears to it, and she says that some people don't believe her. Her daughter was killed by being over-medicated in one night. And I heard her daughter in pain. I could hear her on the phone. It was 9 o'clock at night. And I thought they were in the room with her. She said, no, I'm standing outside the hospital. And she got over-medicated. And a mother knows their child. A mother knows what they're going through. I have a lot of friends that have nonprofit organizations because of a tragedy with a child that passed away because of cancer, chemo, because of over-medication, because of not paying attention to a penicillin allergy reaction and her telling the doctors at UCLA she can't have it. We think because it's a university that we are in safe hands. It is the university that put me on this while I was on prednisone, while I was on nerve pain, while I was on all 3 inhalers. It is the universities that did this, and they have you fill out all of your medical information and your history, and then they call you in and you're wondering, how did they get all that real fast? I'm a new patient. How did they know what drugs I'm on? And now they're prescribing more, and you've got this little pharmacy bag just filling up. It's happened so many times. And I want loved ones that have heard someone in their family or circle of friends who wants to do the hemp or CBD oil to control their pain. I want you to sit down and be patient with them, please. I want you to listen to them. I want you to read the side effects of that versus the side effects of all of this that has all of the fatal warnings on the prescription itself. This is common. This is not a rare, unique thing. There are so many people going through the horrible side effects of pain medication, And it gets to a point where they start asking for more. And these legalized drug pushers, it's not that the one that's asking for the medication is doing something wrong. They're scared. They've got stage 4, they've got stage 3 cancer, they've got chemo, they're already going through a toxic IV. So what difference does it make if they don't just get a little bit higher? That's not bad. I can understand the temptation, but let's get them something else that's healthier. The whole United States needs to have access to this as a pain reliever. I don't talk much about this, but I want to, because when I came across this today, it shocked me. It took me back into a time warp that I didn't ever want to return to. The feeling that I got when I think of them saying that it's 40 to 50 times stronger than heroin, think about that. If someone offers you heroin right now, would you do it? Because that's what we're saying yes to. We're saying yes to something that's 40 to 50 times stronger. And one way or another, we have to come off of this medication. And these legal drug pushers that are treating stage 3 and stage 4, I don't know if they all really give a damn. I think some of them have lost their way. I really do. Thank you.